Well, here we are, Renee, and I am so excited to have another guest on the podcast today.
I am too. I'm really looking forward to this conversation. And I know it doesn't come from a place of being an easy conversation, but I'm very excited because I'm excited to hear what she's doing to make change in our future. And so I'm really stoked about this one today, really excited. But before we get into all of that, Jason, what are we doing on the farm right about now in September? What's going on in your world?
Well, we're getting ready for harvest, and we're just coming off all those farm tours. I'm so tired of going and looking at root zones, digging up and looking at how long the roots are. And we've had all this rust and mold on all the leaves and, having to assess that. And then thinking about, the corn that didn't pollinate because of that, the leaf wrap during pollination. It's been kind of a depressing couple of months, but I'm glad, and no more. It was nice, all the free food, right? Because there's a free meal at every lunch you go to. There's suppers. You get the co-op suppers. We're part of 3 different co-ops. So you get free food out of it. But, I think I'm kind of ready for harvest season to really get underway. So there's what happens. It's free food, going around and talking to people. It's rough being a farmer, Renee, I have to tell you.
Well, Kimberly, I just want you to know I'm not a farmer, and I always find this stuff so amusing. I have no idea what he's get root rot. I mean, what are we even talking about? So that's not.
Yeah, I can't imagine. I kill succulents, so I can't quite imagine being a
No,
farmer.
I
That would
have
not
no
go
idea.
well for me.
It's okay. It's not a prerequisite for the podcast, so you're
Thank
set.
goodness.
I
I'd be
know.
done.
Thank
Yeah,
goodness.
out.
I know. Well, everybody, this is Kimberly Johnson. She's the CEO of Arch Collaborative, and she's working on and out of Redding, California, and working on building comprehensive services to support victims of domestic violence, child abuse, and human trafficking. We are so excited you're here. So, Kimberly, would you just kick us off and tell us a little bit more about you and kind of your background? How did you get here? What's Arch Collaborative? Tell us more.
Yeah, thanks, Renee and Jason, so much for having me. I really appreciate being here. So, I mean, as Renee said, I am CEO of Arch Collaborative based here in Shasta County. And, I sort of joke, I'm going to put a visual in everybody's mind that I sort of stumbled into this work kind of like a newborn baby giraffe, like trying to find my footing. And then eventually I sort of learned to walk. And then something else comes up, and I still sort of feel like a baby giraffe some days. But I'm in that kind of weird college dropout that learned how to ask some good questions, learning disabilities CEO bucket in an unexpected way. I actually married into the nonprofit space in 2008. My kid's dad had a large nonprofit in San Francisco and really just fell in love with the work. And so in 2016, after several years of just kind of learning alongside him, was doing some advocacy work for victims of child trafficking here in our local juvenile hall. And working alongside those victims. And I got invited to attend a sexual assault response team meeting, which is essentially a collaboration of any agency that would be involved in a sexual assault. And I listened as every single leader around the table said, the greatest need that we have in Shasta County is a children's advocacy center. And I had never heard of the model before. I didn't know what it was, but I, at this point, had kind of found my footing in the nonprofit development world. And so went home that night, started to Google, and really just fell in love with this incredibly collaborative, innovative model of how do we ensure that we're not compounding systemic trauma to a victim of child abuse, right? So we're ensuring that not only are they able to access a forensic interview in a trauma-informed space, they're also not having to retell their story of what has happened to them in really unfriendly settings. Of course, it's kind of hard to imagine, but so there were victims that were having to retell their story in the same room where a perpetrator was being interviewed, right? Like, I mean, it was just really kind of challenging. And that's not just in Shasta, but it's all over. And so I asked if I could help be a part of that project. That was 2016. And, thankfully, my original goal was, can I just take some meeting minutes? And turns out like we actually worked together day in, day out over the next, really, it took us 5 years to open the doors on our first center. So in 2021, we opened the doors on what is now a nationally accredited Children's Advocacy Center model we're incredibly proud of. We've done over 850 forensic interviews alongside our partners in law enforcement, child welfare, the DA's office, victims advocacy, medical. And I think why that matters to the entirety of the conversation and why I take a little bit of time to set that up as a foundation is because I didn't build a table and ask all of these allied agency partners to come and sit at my table, right? Like we actually built the table together. The foundation of our work was built in a multidisciplinary way. And then, of course, the first thing was the reduction of systemic trauma, and then it became how do we help them heal? And so we opened an outpatient behavioral health clinic, and in our mind, we were going to be, break even within 4 months. And turns out we're 2.5 years later, and that program still operates at a pretty significant deficit. And we are doing everything we can to bridge that from a funding gap, even though we have the providers. But we now have 8 clinicians that work for us, and so it's our primary referral source. And then parallel to this journey, we applied for a pretty significant grant with the state of California that was to build a comprehensive continuum of services for CSEC, for trafficked and at-risk youth. And the intention of it was to provide both residential as well as behavioral health services in an integrated way, specifically to victims of child trafficking. Right. And so we've been awarded about $11 million going back to 2020 up until now. And we bring these programs online in the rural and frontier north and saw some pretty significant successes and lots of lessons learned. But really, you had funding that was coming from the Department of Social Services that required sustainability from the Department of Healthcare Services. And we saw the really significant breakdowns begin to happen as it came to the behavioral health contracting and billing, especially in rural and frontier counties. So unfortunately, we had to close 2 of those programs down, which was really devastating to have happen, but it really gave us a front row seat to understanding the depth of the problem. And now, like, really our highest aim is like, how do we both serve our clients every single day, and then how do we help fix that problem? I think the last piece that is potentially relevant is in 2023, I was given the profound honor to step into a leadership position with One Safe Place, which is our local domestic violence and rape crisis center. And so that's when we rebranded the nonprofit of the Children's Legacy Center to become Arch Collaborative, because we're moving towards a merger with our local domestic violence and rape crisis. So now we have, 70 some odd employees and provide really comprehensive, robust services to victims of violent crime. And I'm really working on the systemic solution as a part of the behavioral health transformation that is coming from the state of California pretty significantly, specifically to a multi-county behavioral health continuum infrastructure project for crisis behavioral health services. So that was a lot. I'm now going to pause and see what are all the questions that you have.
I have too many questions. I started taking notes midway through. So Renee, go ahead.
No, I was just going to say, so in my day job that you may or may not know, and I'm not sure if I got to tell Noah this, I'm actually the chair of our board of parole here in our state of Iowa. So I work, and I got here as a mental health clinician, and I was doing it very part-time up starting in 2021. And then when the chair stepped away in 2023, I have a business with Jason, and we create behavioral health systems. And so when the chair asked me to consider taking the chairmanship, I thought that was insane. And I thought Jason would say, no, we need to do our business. And he's like, no, this will be great. So I took chairmanship, and the governor appointed me in 2023. So I work on the adult side of all of this now. Wow. On the side of all of the folks that are, and victim advocacy is a big piece of our work every day. So I just want to say thank you for that, because I've seen firsthand exactly what you're talking about victims having to be in the same rooms and being intimidated and not being able to share their stories and all of those things. And we're having some legal battles over that today. It used to be able to do it by video, and then now they're saying that that's not fair because they don't have the ability to really have due process if the person's not in the room. And so there's these intimidating factors, and it's just a really big challenge. So I just wanted to put that in there before we have lots of questions about all of this. But what I'm really excited to hear more about is talk to us about like the crisis piece that you just mentioned there at the end. So what does your continuum look like in Northern California today, and what do you hope it looks like moving forward?
Yeah, that's an excellent question. And Renee, I mean, I think the fact that you come from a behavioral health background, mental health background, you come from that, but yet you're in a seat within parole. I think what we're seeing is that the days of these agencies being siloed as it comes to serving, whether it's victims of violence or even offenders, violent offenders, the days of those silos are gone. Like we cannot silo those anymore. So you being in that position is so critically important, and actually gives me a lot of hope for your state, because so well done to the governor for making that decision. But to answer your question, I mean, there's sort of 2 kind of crisis continuum components, but I think we'll talk more about the behavioral health side. I think on our direct service side, we provide a 24/7 crisis hotline for victims of violence. And then we additionally provide a crisis walk-in service. We have a domestic violence shelter that can also we say domestic violence shelter, but really it's for all victims of violent crime. So we've had victims, obviously human trafficking, we have a number of those cases. We additionally can serve victims of hate crime. I mean, you name it, like victims of violent crime, we can really serve within that domestic violence shelter. And then we have a little bit more of a continuum as it relates to, we have a transitional housing unit, and we really, that program has really grown in the last couple of years. But really, I think what's been interesting on the adult domestic violence side of things, the adult victims of violence side, is there really is a pretty significant lack of standards, both statewide and nationally, as it relates to accreditation standards and clinical integration standards. Whereas on the child side, there's a lot of that, but for the adults, there hasn't been. So any of those integrations, especially coming into, starting a nonprofit that has grown and then now taking over a nonprofit that's been around for 50 years, there's a gap, I think, both at our state level, but also nationally, as it relates to integrated standards of care for how are we providing integrated clinical services for victims of violence. So that's kind of its direct service side of the work that we do as far as our programming. But then additionally, on the behavioral health side of the work, what that looks like is within the state of California, the governor's office has been working on something called the behavioral health transformation really since 2021. And so one of the big initiatives was the Behavioral Health Continuum Infrastructure Program. And it was originally $2.5 billion that was given out specifically to infrastructure development. And then Prop 1 passed in March of 2024, and that added an additional $4.4 billion in bond funding to infrastructure only. And as you saw, like if you would look at a map as to where are those dollars going across the state, even though the state really did a good job in trying to break apart to ensure that those rural counties were able to leverage those dollars, a lot of these rural counties just don't have the capacity to be able to apply for these funds and to leverage them and draw them down and maximize them, right? So after Prop 1 passed, there's two other like really big things that are happening within the state of California that I think are relevant, in part because in a lot of ways, California can be the neck that turns the head of the nation as it relates to driving some of these services, I think in a really beautiful way at times. One of them is Prop 43. And Prop 43 essentially expands our language for what is considered gravely disabled. So somebody that qualifies for hold used to just be mental health. And we've now expanded that to include substance use disorder, as well as a couple of other things. But we're starting to see that integration from where behavioral health and where mental health and SUD have historically been siloed. We're seeing those things come together. The other big one that happened as a result of Prop 1 is we went from the Mental Health Services Act to now the Behavioral Health Services Act. And so we're seeing this massive transformation where mental health and SUD are now coming together, which for a lot of the providers makes a lot of sense. The challenge is we're going to see a really significant lack of bed availability, hence why this infrastructure money has been made available, but we're seeing disproportionate drawdowns of those dollars in rural counties. So that initiative is the primary thing I've been working on, is this grant application to draw down that money to build out a crisis continuum here in Shasta County that would serve the rural and frontier North state.
Wow. Yeah, and I think that's what I'm really interested is how do we better advocate for those rural areas? Because it's different. It doesn't matter what state we go to, and we've been in a lot of states that I didn't realize how rural they were until I left. I'm like, shoot, right?
Yeah.
We were just in Arizona at the Rural Health Conference, and I didn't realize how rural Arizona was.
Right.
And that's why sometimes it's helpful to go walk around in some of these states and be like, oh, we all have those same issues. And so when we think about that and how can we better balance the scale, for lack of a better way of saying it, how do we better do that looking at the differences between where you're at in California and further Southern California, where you've got a lot more population? What can we do there?
Yeah, I love the question. I mean, I think that one of the things that I have realized is so I was born and raised in Dallas-Fort Worth, Texas. And so I've been in California since 2008. Was originally in the Bay Area and then moved up to rural Northern California in 2011. And have really been on the side of like kind of advocating for this work, especially pretty heavily trying to understand the landscape of the rural and frontier North since 2019. And actually in 2019, I traveled to 22 Northern California counties and sat and met with, behavioral health directors and HHSA directors and law enforcement officers, and really tried to like listen to their story and understand what their needs were and that was as we were building out this services for trafficked youth. And within that, I think, having been a part of a state that has such a deep and profound value for equality and also for equity, I think that the challenge is that it's really difficult to apply that same standard of practice that we have as a core value as a state to the individual to the 58 counties. And yet the 58 counties really need, in a world where you have the funding flows from federal to state to county to community-based organization service provider for the most part, especially for those with severe mental health needs, behavioral health needs. In that funding flow, if we're not really trying to understand the counties from their perspective, then really what we're doing is we're sort of operating from a place of privilege, and we're saying, hey, for somebody who hasn't grown up in, from a place of privilege, pick yourself up by your bootstraps and figure it out, right? And if you don't, like, here's all the regulations that you're required to do. If you don't, here's the fines that you will incur, and so we're seeing these regulations that come down. And I've had enough connectivity internally with the state to know that you have these like passionate advocates, and you read some of the things like the grant language or the bills, and they really are the heart and drive behind them is exactly where we need to be going.
Mhm.
It's the execution where it's breaking
Right.
down, because we're not listening to what is it that the rurals say that they need, and how are we coming and sitting next to them and getting our hands in the dirt to try to understand their perspective, because they are the experts, right? Versus the expert saying this is how we're assuming what you need versus how
Yeah,
we try to
absolutely.
understand what you need.
Yeah, you got to have someone out there willing to do that. Now, am I right? You have a third party who's actually managing distribution of those funds in California, right? Is it AHP that's
AHP,
actually?
Advocates for Human Potential, is
Yeah.
managing the distribution of those funds. Yeah.
Yeah. And so, I have some friends that someone who I think very highly of, that mentored me many, many years ago, who's done a lot of that leadership out there, and I think that's always the challenge, is how do we complete that feedback loop? We've done some of that work in different states where, we do the driving all the way across the state and go to all those counties like you did. But that information has to get back to those entities making the decisions, or the state has to empower those entities to make decisions based upon the lessons they've learned in those rural areas,
Yeah.
so they can create the impact that's
Right.
necessary for those things. So kudos to you for that advocacy, because that is hard work. And it's not always easy to pin down who the right decision maker is that needs to be educated in that process.
Well, and I think that that's a part of both the beauty and the challenge, right? Is that there isn't any one decision maker, right?
Yeah.
The system is a part of a body. And so like true integrated systemic change that lands into a place, like I tell my team this frequently. So our building, as I said, our Children's Advocacy Center has been open since 2021. And we had probably 6 months worth of meetings to just talk about scheduling. Like, how are we going to make this scheduling work? And we met every single month for an hour and a half, and we would try to piece this together, and no and yes and no and yes. But now, like, nobody gives a second thought to the scheduling, because it is now stitched into the fabric, not just of our agency, but of the multiple allied agency partners that are a part of our process. Right. And I say that because number one, systemic change is possible, right? Like it is. And these even things that feel like micro changes are incredibly hard. But if you do them together with a multidisciplinary team, I think that that's kind of where the magic resides. The other sort of big piece, and it's funny because I could say this too, just even with my internal staff and team, not only within the advocacy work that we do, it's the communication breakdown, right? So when we have behavioral health transformation that is coming through the Department of Healthcare Services and coming through the county behavioral health departments, but as a part of that, you have to have law enforcement be a part of it, because there's a whole justice involved initiative. But behavioral health and law enforcement don't talk the same language. Like, they just don't. And I remember one of my favorite moments with a law enforcement officer was like, KJ, and they all call me KJ, which I love, and it's my most favorite thing. They're like, if I cannot read your email on my watch, I will not read it. Stop sending me emails that are so long. And so literally now, to this day, that was 5 to 8 years ago. To this day, when I send an email to anyone in law enforcement, I think, can he read this on his watch? Can she read this on her watch? Because if she can't, I'm not going to send it.
Right.
Whereas like when you're talking to somebody who's an LMFT, totally different, right? So when you have these entities that we need one another, and we're not yet speaking the same language, right? But we're really trying, and there's so many innovative, I don't know if you have talked to anyone from Grand Mental Health out of Oklahoma, but my gosh, oh my gosh, their crisis mental health director he's former law enforcement, right? He's got this like big burly beard and finger tattoos, and he's a former law enforcement that became a therapist. And the way in which that they engage with one another, because we understand that those systemic silos, those days just have to be over.
Yeah, and I think, what you're describing is how do we take those programs and, there's a term, I think it was our DHHS director who started calling them hero programs, right? How do we take these pockets of innovation and expand it
Yeah.
so it becomes bigger, so it becomes the norm across the entire state, and then becomes the norm across the entire country? Because we have to move beyond having a great program in Reading and a great program in Oklahoma and having great systems and structures for everyone,
Yeah.
no matter what state you're in. And so I think that's exciting. And how do we break down those barriers? I think that's something that we all are focused on every day. Renee, I know you have a question. I can tell you're just itching to talk.
It's okay. I was thinking about, you were talking about the crisis system and all of the Prop 1 that came down, and now you've got this other prop that came down with housing. What do you see as like still a gap in your policy that you need? I mean, yes, you need time to implement those, but are there still gaps in the policy piece that you're like, this would be like the next step of what we all need to make this collaboration work, or have you seen that yet?
Yeah, I mean, I think that the biggest breakdown. I mean, right now, our current crisis response, it's hospitals and jails, right?
Yeah.
Or juvenile hall or
All of
county
that.
offices,
Yep.
right? That's what we've got. So I think the biggest breakdown challenge, if we set aside like the workforce stuff and we set aside the lack of bed availability, we set aside those pieces. I think where the magic can reside in terms of solutions is when you take multiple licensing types that need to come together in order to actually build a continuum. That a hospital is they're not beholden to those licensing types, but the moment you're out of a hospital, the model that we're looking at designing is 6 licensures that all kind of compete with one another and have some things that make sense. But in order to be able to say, how does our mobile crisis team or our law enforcement bring somebody to our front door, drop them off, and us be able to provide services in a way that ensures that we are driving the least restrictive setting possible, that also says we can do a crisis stabilization unit. It's 23 hours and 59 minutes or less. The problem is based on our hospital data right now, of the 2,000 people, give or take, that came to our hospital, and that was fiscal year 23, 24, it was an average of 4 hours to get a 5150 exam and 34 hours to place. And then
Yeah.
we're asking a county to provide transport, and they're driving 5 hours to bring somebody, even from rural and frontier north, and they're just driving to Reading. Imagine trying to get them to drive to Sacramento. They can't use crisis stabilization because they would have to turn around and come right back 23 hours
Right.
later, right? So then you can do crisis stabilization in a locked unit, but that's not what everybody needs. So then you get into the middle ground. The middle ground is like a crisis res or a social rehab or a something, right? And you're trying to sort of Frankenstein together this model that the licensure types allow for a continuity of care, right? And versus something like, what's interesting in Oklahoma is they're a CCBHC, and the CCBHC model, California is not a demonstration state for CCBHCs. And so we have one local CCBHC, but it was on a one-time kind of grant. That funding is until the middle of next year. But so I would say the biggest breakdown from a policy standpoint, it comes in okay, how do we get, I mean, honestly, from the governor's office, who is really driving the behavioral health transformation in such a passionate and informed way, to the Department of Healthcare Services, Department of Social Services, HHS, who actually Mathematica just put out a report on Shasta County, which was fascinating, on behavioral health, Department of Justice, right? And then public health. How do we sit down and say, how does this work for somebody in Modoc County, right?
Mm-hmm.
So that's county. Then we get to provider. On the provider side, it's how does this work from an economies of scale, right? So this staffing model says we have to have this. This staffing model says we have to have this. Dear state of California, can we work together to figure out an economies of scale model where we can do some shared staffing strategies, right? And I think the state has been, I think at a big picture level, California, it's the 4th largest economy in the world, right? Like this is massive. And so they kind of have had this sort of like not great reputation for like getting into the nitty gritty and in terms of being siloed at state levels.
Yeah.
But honestly, like the systems of care branch has really tried to drive, and we've seen some legislation like AB 2083. It was the interagency leadership team ledge that came out a couple years ago, where the state is really trying to break down these silos. But the policy change that needs to happen is, how do we take the information that we already know what we have? It's not that we need to add more ledge. It's how do we take what we already have? How do we piecemeal it together and make it work? And then where is the state able to say, these are things that we can create solutions on and bend on? How that translates into policy and ledge feels honestly like above my pay grade. And that's not, I'm like, I like puzzles. Like,
Well, but
but
I love what you're talking about because I love continuum of cares. And I love looking at the continuum of care,
right,
whether I'm looking at it from the state perspective or a local community county perspective. I should see the same continuum. I should see the same definitions along the continuum. How you access and transition folks through that continuum may look differently. And what
that's
I
right.
hear you saying is there's a big disconnect between what's accessible within the continuum and then the difficulty in making those care transitions that make sense in an appropriate way, based upon clinical necessity or medical necessity or whatever terms we want to go with, whether we're sitting in a healthcare seat or behavioral healthcare seat. But our vision is it should look the same, right? We should be able to transition folks to the right bed at the right time when they need it, where they need it. And those things don't have to be unattainable. And they're not always related to a building, that we can think a lot outside of the box if our systems allow us a little more flexibility to be able to do things that make sense for people at the time and
Yeah.
are appropriately matched. So I love the conversation. I think that's really exciting because those are difficult things to do and you can get overwhelmed. And that's often what we talked about to people about just listening to you can be kind of overwhelming. Like there's so much going on, but you can't eat the whole elephant in one bite. We got to figure out how are we going to cut this up and how are we going to make this manageable and
Mhm.
try to figure out where can we make the most impact over time, and
Yeah.
keep working toward that ultimate goal.
Yeah, my policy brain, I mean, this all went right down to it's basically insurance and billing codes is where you're stuck. Somebody's not getting paid for the position. And so you've got the work, the workload, the clinical pathway, the people that are involved, but the billing codes just aren't up there to be able to say, this is what this is going to get paid. This is what this is going to get paid. This is what this is going to get paid. And then attach it to the correct licensed person to make sure it all happens. In a nutshell, that's the minutia that people think are so boring. It's so terrible to talk about the rubber meets the road. But when you're talking a system like that, if we're only talking the policy at that 30,000 foot level and we never really understand how it goes down to a provider getting paid, we've missed that boat because they can't do it for free. And so then it's what's left. And we always call it wraparound or we call it, you name it, what we call it. And then there has to be some other bucket, whether it's foundation money, private money, some other money to fill that in because those are services that are absolutely required for complex needs to be stabilized, but they're not a billing code to be found to be able to get it back to a particular place to count it. And so, it's that minutia. That's the boring part to a lot of people. That is exciting to me. I read those budgets and I can see those spots and go, that is the where the breakdown lies. Because again, I don't know about California, but Iowa, we're really good at having lots of initiatives. We're really good at the next big thing, the next squirrel, the next thing we're chasing, the next, whatever. And we don't ever implement them or look at the data to see if it actually mattered on the back end, where that part's boring to our state apparently. And so we don't know where like look dive in and go, okay, where did this work and where it's not. So what I'm excited about for you is you really now have eyes on and people who understand that it has to work from top to bottom. And you still in rural community, it can't just work in the big cities. And they have different challenges than you do. I guarantee without even talking about it that theirs aren't working great either, but differently challenged than yours. And so, it's a really great conversation. Was there anything else you really wanted to highlight today on the podcast that Kimberly that you wanted to share with us that maybe we didn't dive into, or another question
I
you'd
mean,
hoped we tapped into?
yeah, I mean, I think if I could just quickly respond to those kind of 2 points. I think one would be because our current system is set where anything that is a severe mental health need is flowing through the counties. The challenge is anytime you have change and innovation, it takes a certain level of, you can't both be like dealing with the fire that's right in front of you and try to do next year's fire strategy and try to drive innovative solutions. And so I think kind of what we're seeing in the rural north is this critical mass that we've reached as a result of so many post-Cal AIM innovative solutions, because we actually have a number of billing codes that could work. It's the way in which all of those dollars are leveraged and drawn down and maximized, and even some of those kind of like unsexy behind the scenes contracting pieces that are really complex because they're new. But what I will say is I think the two things that I would quickly say, one is I keep in mind that I think it was Chick-fil-A that and I need to like fact check this, but I think it was Chick-fil-A that when they were trying to get their frontline staff to essentially say, my pleasure instead of you're welcome, it was a 2-year process. Like something as simple as that, that you would think like, oh gosh, I could just send an email. No, no, it was 2 years before that was like
Yep.
stitched into the fabric of the culture. So this is going to take time.
Yep.
The other part that I would say is for me, all of this work began as a how do we create a simple interview center to be able to help kids not retell the story of their abuse? And through doing that with our allied agency partners, we built something pretty epic and learned to trust one another. So then it became, what do we want to build next? I think for me and for the rural frontier North State, my hope is that this Beach Up initiative that we're working on and this crisis center, that we are putting forward something that is massively risky for our lead applicant, which thankfully they're willing to come to the North State and try this with us. There was one that was willing to try.
Mhm.
We are putting this forward without a full sustainability very clear because we know that it doesn't entirely work on the crisis side because of all of these things that we're talking about. But I actually believe that this little project, it's not little, but this project that we are working on will be our next version of an interview center where we will see a catalyst to regional change in the rural and frontier North State. So fingers crossed, y'all please stay tuned. And I am clearly going to be listening in, if for no other reason than Jason, to hear whatever is happening on the farm.
Well,
And this was just, it was such a privilege to get to talk to y'all. But bottom line is there's lots of hope. I have lots of hope.
Lots of hope. Well, before we go today, I always kick off the recovering politician self-care policy of the week. And after Labor Day, it's just time for me to adjust my workout routine. We talk about this at the beginning of the summer, but as it gets colder, my outdoor pool gets a little chillier in the Midwest. I'm not in California, so I don't get to have that great weather all year round, and it gets a little chilly. And so I'm going to have to like move back inside, which I'm blessed. I have the opportunity to have an indoor pool access, so I'm not complaining about that. But there's other things that I like to do more in the fall that are just too darn hot with all the corn in the ground. And so as Jason gets all that corn harvested and gets all that corn sweat out of our air, there's some things outside that are kind of lovely. So I can actually go back outside, back on my bike and spend some more time out in the community. So Jason, when it gets cooler for you after I know you're in harvest and you spend a lot of time in the cab right about now, but after that, what do you do to keep yourself recovered when you're out and about on the farm?
well, then I have to haul that grain to the ethanol plant. So no, I really don't get any time off until, it's December and it's really cold and snowy out. So no,
That's true.
I think fall is a great time. And it's a great time as the seasons start to change, that to just be outside, enjoy it. I always like having those fires in the fire ring out on the patio, and I think that's what I think of as fall. So roasting some marshmallows, those are the great things about fall when I think
It
about
is.
fall. And
The
that's
great thing
also,
about fall.
it does go back to, what do we look forward to every day? It's not always the big vacation. Sometimes it's taking 10 minutes
Yeah.
and enjoying something relaxing at the end of the day. And we don't always take time for that. We talk to so many people when we travel and they can't identify that one thing. And we're like, you got to put you first. So
Yeah.
remember, it's the little things that matter.
Yeah. Well, for me, it's football. I've got my,
Wow.
can't see it,
Of course.
Pittsburgh Steelers on today. We're already prepared for the fall. It's coming. I know, I'm excited. But today, everybody, we got to meet Kimberly Johnson. I'm so excited to have her on today. They're doing such awesome stuff in the northern frontier part of California with her Arch Collaborative. We have a ton of information for you in the show notes about some of the statistics in her community that we didn't really dive in today, but just about some of the work that she's doing, about the collaboration itself. More information if you want to know about their crisis continuum, which is really exciting, and the work they've done even on California 988, which is really cool. So we've got a lot of information in there in the show notes for you. Hopefully you'll connect and see a lot more information. But before we go, just want to remind you, if you follow us on LinkedIn, social media, Facebook, we will send you all a prize. Have a great day, everybody. We'll talk to you soon.